Professor Shore, you've been an inspiration in my work and in my life. I'm so delighted for you to join me. Thank you for taking the time.
Oh, it's my pleasure.
You're a professor at Adelphi University in New York, but you're also an autism advocate, and you've done amazing work, and your insights in just growing up, being autistic, non-speaking until you were 4 years old. The way that you explained your parents' role and how they brought in music, it's a very modern approach, I feel like. I wondered if you wanted to elaborate on that, or if you have any guidance for parents with young kids.
Oh, sure. Yeah, I'd be glad to. And what my parents did is, they were, I guess they were very modern, as you said, although or ahead of their time, is that after the regressive autism bomb struck at 18 months, they first went to seek medical help and for diagnosis. And it took them a whole year to find a place for diagnosis. Because there was so little known about autism. But with their persistence, they did find a place. And we're told that, your kid is really too sick, send them to an institution. Mm-hmm. Now, fortunately, my parents, like we see so many parents today, and expanding that to increasing numbers of parents around the world, they advocated on my behalf. And they convinced the school to take me in about a year. However, it was during that year that my parents were cast adrift and had to develop what we would today refer to as an intensive home-based early intervention program. And this was a program that emphasized music, movement, sensory integration, narration, and imitation. And that's just today's terminology. If we look at the current programs that we have today, or interventions we have today, I suppose we could say that it was more of a developmental, cognitive, relational, play-based music approach. Okay. So maybe it looked like something that we'd find practiced in the developmental cognitive Miller method, or the developmental relational development intervention approach. I also see some aspects of what is practiced at Boston Higashi School called daily life therapy. Now, the thing is that these concepts, these interventions didn't exist at all. The concept of early intervention didn't even exist. It was really just parents desperately trying to reach their kid. So what did they do? Well, first they tried to get me to imitate them. And imitation's a time-honored strategy. Everybody does it. I'm sure you do it too. And most of the time it works very nicely. But for autistic people, perhaps due to a difference in mirror neurons, especially when young, it didn't work. So my parents flipped it around. And when they flipped it around and imitated me, I suddenly became aware of them in my environment. And they were able to move me along.
That was brilliant.
I believe the key implication is that as a prerequisite for doing solid, authentic work with an autistic person, you have to meet them where they are and develop a trusting relationship first. And then you can move on. And I think that holds true with everybody else as well.
Exactly. I was just going to say, I think that's for every relationship. The rapport building is so important. And if you don't trust somebody, you can't expect them to learn from you. You need to have that positive rapport. And that was beautifully said, because I read that about what you said about your parents, is that they flipped it around with the imitation skills, and they started listening and looking at you. What are your interests and what do you like to do? And they just started imitating that, which I think is something that most parents can do. You can follow your child around, observe what they're doing, go down on their level, see what they see. If they're looking at objects from the side, you can also engage in that and just see what they see in their world, and then we can start working together.
Exactly. And what this is I see it as the next level in what I often refer to as the 4A's of autism. And in that first level of awareness, we've been at it for over a generation. And we've gotten so good at recognizing autism that we see it in 1 in 54 people, or at least according to the CDC in Atlanta, which means there's an awful lot of autism. And what I tell educators is that if you don't have an autistic kid in your class, the numbers will probably catch up with you and you'll have one in the next. And what all this awareness does, recognizing autism at home, in the community, in the workplace, in education, in increasing numbers of autistic people reading about it and saying, well, gee whiz, maybe this is me. I better go get it checked out. And what my parents did, and I see increasing numbers of parents doing, and educators, is taking awareness to the next level, which is acceptance. And that's number 2, acceptance. And transitioning from working against autism, trying to make autistic people more like everybody else, poor imitations of non-autistic people, but more towards, well, let's see what we can, let's work with the autistic characteristics and help the autistic person be the best autistic person they can be.
The acceptance part has come very far. And, I think it is definitely an advocacy. Autistic advocates have done such an amazing job with that. And also the therapies, like you mentioned, that are listening and working in collaboration with autistic adults and younger kids too. Ourselves, we're also working in collaboration with autistic adults. We've got advisors that are autistic, and it's crucial. It was eye-opening for myself. I was an ABA therapist and I started listening to autistic adults, and we started bringing in a lot more of a focus on their strengths and interests, and it made a massive difference. We're seeing our kids not being angry and frustrated. They're really trying to open up and show us that, yes, I do want to become a friend, or I want a life that is social, but in my own way. And that's perfectly fine. So you were saying about the second A. What is the third A?
Oh yeah, we got a couple more to go, actually.
Yes.
So the third A is appreciation. And appreciation is where autistic people are valued for what we contribute to society and what we're able to contribute to society. And we're beginning to see this initially in some of the large IT companies, such as Microsoft, Google, SAP, Apple, and so on, who actively seek autistic people as their employees because they know a number of us can do things in IT that other people either can't do or do them much faster. However, that does come with a caveat. And that is, while I support all of this publicity around autistic IT super geekery, and it's great, and keep going at it. My question always is, what about everybody else?
Exactly. A lot of the parents are asking, but my child is not IT driven. They're not interested in those kind of things. And I keep having conversations with people that are brilliant, like yourself. And it's inspiring for parents, and also it gives them a lot of hope. But some of the parents would ask me, but what about my child? He's still non-speaking and he's 10 years old. So that is such an important point, and one that should be made.
Oh, it is. And I know of some examples where people who have skills in other areas, actually autistic IT geekery only occurs in a minority of us. And it's not that big a group, but it's big enough for these companies to take notice and squawk a lot about, and that's good. So for example, I know of a fellow in Florida who does need more support. He'd probably be diagnosed now, maybe he is, diagnosed as autism spectrum. I don't want to say disorder, I want to say different. So just autism spectrum, you don't even need the D. Autism spectrum level 2. So he needs supports in communication. He doesn't speak much at all. He's non-speaking. And I prefer to use the word non-speaking rather than non-verbal, because there's a lot of communication that goes on when people are talking to each other, like we're doing now.
Exactly.
And depending upon the research, that other channel, non-verbal channel, might be up to 93% of the total communication package.
Yes.
So to say someone is nonverbal, that means they don't understand language, which is a very serious condition or situation, which some people on the spectrum, we are in that space. However, I know many non-speaking people who, once we get them on an AAC device,
Yes.
they're communicating just as well as the rest of us. So getting back to this example, this is someone who has an AAC device, and he's got some words here. It's work for him, but he can communicate. So he needs support in communication, social interaction. He also needs support in just getting around, transportation, and managing his daily schedule. However, he does have this curious interest in folding laundry perfectly. And I know many people who would like help with their laundry. He'd be happy to go right to your house, and boy, he'd be the happiest person in the world folding your laundry. However, you'd have to pay him to do it.
Yes.
That is his job. He spends all day in a hot laundromat folding laundry faster and better than anybody else. And he enjoys it, which is so important, a vital aspect. He's productive, he's fulfilled, he's appreciated for what he contributes to society.
Yes.
And what that suggests is that there's room for fulfillment, productivity, and meaningful employment for people all over the spectrum.
Yes, and that's very important, just to pause on that point for a second, because I've worked in the field now for about 16 years, and some of the kids that I worked with that were very young, they're all grown up now, and I still call them my kids, but they're young adults now. And I believe that it's more of an individualized approach that you should take with individuals that are perhaps not so interested in IT or systems thinkers, because there's a group, like you said, Microsoft, Apple, SAP, that are interested in hiring these individuals. But what about those people that you were just talking about, the individuals that don't fit in that mold, I would say? One person might be interested in folding laundry, and that is a meaningful occupation for that person. And another person is really good in doing art, and they might be creating some cards for a bigger company like Walmart or whichever other company that they can find a job at. But it needs to be something that is structured. Every January they make cards that are themed in this manner, and every February it's like Valentine's, or March it's something else. And that could be something for that individual, but it is a very individualized approach, I feel like, for the individuals that don't fit in specific groups of interest.
No, there's huge diversity in autism. And it's possible that the diversity within the autism spectrum is even greater than the diversity outside of the spectrum, which is why I often say that when you've met one autistic person, you've met one autistic person.
Yes, that is very true. And the fourth A?
Oh, the fourth A, yeah, let's get to that. The fourth A is action. And action is the work that we do to recognize autism as it occurs, to make sure that we accept and work with the characteristics. And what I mean by acceptance is you have an individual on the spectrum, you go outside, they melt down and engage in some pretty horrific behaviors. So we say, oh, they're autistic, just let them do it. That's the wrong type of acceptance. But acceptance is, well, first we're going to find out why this is happening. Oh, it must be sensory issues. That's why the child fails the Walmart test, which is you go into a Walmart or any big box store like that, and the kid melts down due to sensory overload. We're going to try to find other ways, either other ways to get what we need, or we're going to teach the child how to cope with being in a Walmart, possibly with ear protection, possibly gradually getting into it. Well, we're going to go into Walmart today. We're getting a carton of milk, and that's it.
Yes.
We're just going to
Slowly.
go and get one thing and go, and you as the adults are not allowed to change your mind. Oh, but we also need this. So let's just go over here and get it. You can't do that.
Exactly.
And some people will be able to tolerate and work with that. But for others, you can live a fulfilling and productive life without going into Walmart or a store like that.
Yes.
Anyways, so that's the work that we put into it. It also means using strength-based approaches.
Yes.
And an example for that could be, let's say we have a grade school child who's not interested in math. There's no motivation to do it. So what do? We call in a consultant because everything we've tried just doesn't work. And the consultant will probably do an interest inventory. Let's see what the kid's interested in. Follow the kid around, talk to other people. That's all good stuff, triangulating the information. Oh, we find out that this kid lives to use a flight simulator at home on the computer. And what often happens that we need to get away from is, oh, okay, this is a powerful reinforcer for you. We're going to take it away, but you can earn it back if you meet your goals in math. And that's working, what I say, against the characteristics of autism.
Yes, that is so true.
If you want to work with the characteristics, you recognize this highly focused interest and you work with it. There's certainly plenty of math in flying airplanes and using flight simulators. And now mathematics will become intrinsically reinforcing, if you want to use behavioral speak. And everybody's the better for it because you're recognizing and working with the strength.
Yes, exactly. We do this all the time with our families, and sometimes we do get comments or replies like, but they're just playing all the time. And really it is, yes, they're playing and they're doing their interest, but they're actually doing a lot of other work that we don't think about sometimes. Like you said, interest-based activities, you can incorporate all those academic skills, you can incorporate collaboration, communication, social interaction, all those things. So we even have like activity maps where we show a parent a simple activity like baking, if your child enjoys it, can become such an educational activity. And that is very important because I think we went through a phase where everything, like you said, was reinforcement based. And we worked like that as well a few years ago, or a decade ago now, I should say, where a child needs to work for an amount of time and they get a small little time period with their reinforcer. And that is horrible for any person to do. I mean, if you tell me that you're only giving me 10 minutes of reading time after a full day of work that I don't enjoy, let's say I wasn't working in this field, I would also be frustrated, and I would also engage in possibly behavioral outbursts. So I think that's a very important point. Speaking of parents, do you feel, Professor Stephen, do you feel that if we help train parents and we provide them the support and the strategies, very much like your parents had intrinsically already engaged in, do you feel that parents might be able to do a lot of the concepts, engage in these concepts and activities at home? And could that possibly decrease the 40 hours of therapy that are usually prescribed for parents to do?
Oh, absolutely. As Thomas McKean says, and he's one of the first people to get out there and write an autobiography on autism and to be speaking right with Temple Grandin in the early days.
Okay.
And he says that to support the parent is to support the child.
Yes.
And the parent is the first line of support. Parents spend more time with their child than anybody else.
Yeah.
And parents are the experts on their children.
Yes.
So we have to work with the parents.
And I think that's exactly it, that statement right there. The parents are the experts. It's not somebody that comes in, they don't know your child. And, we always say that we do individualized programs, and we do, but the parent is the person that can really individualize that program, because they could tell you, no, my child will definitely not like that activity. and let's try something else that I've noticed that he likes. And I think that's when it's very important to take that stance back and just observe your child more and more before you start even trying to engage him or her into an activity.
Exactly.
Is there anything, speaking of your parents again, is there anything that you would wish that they knew when you were younger?
I wish they knew more about sensory issues. They kind of had an idea without the terminology, because Jean Ayres was just beginning to get started on her work with sensory integration. And an example of where this caused a challenge had to do with haircuts. Many autistic people have difficulty with haircuts. And for some, it's the light touch. For others, it's the sound of the buzzers. For others, it's the smell going into the barber shop. Well, we did haircuts at home. For me and for many others, I would complain that haircuts hurt. Well, hair has no nerve endings, so it doesn't make sense. However, if you realize that when hair gets cut, each strand gets a little tug along the way, and some people feel it more than others. And that's exactly what the problem was. And no amount of explaining, as well as a 6-year-old autistic kid could explain, enabled my parents to understand what the problem was. So had they understood more about sensory issues, had there been more information about it, I think that would have made things much easier.
Yes, and that I'm so happy that there is such a focus now on sensory integration therapy and just finding out what your child is hypo or hypersensitive towards. Speaking of that, though, again, if we just go back to what you said in the beginning, it's important to do those sensory activities before an outing, during an outing perhaps, and definitely afterwards, but exposing your child to these environments, because it's wonderful if some of the shops do have the quiet hour and, you know, where the lights are dimmed, but not all of them are going to have that. I live in Portugal, and that's definitely very far ahead in the agenda for the Portuguese shops to incorporate that that very important factor. But I also think that it's needed to have a child that is able to cope in these environments when you give them the coping skills, like you also mentioned.
Right, and helping that child understand where their boundaries are. Yes. So, for example, it's probably not a good idea to wear ear protection all the time, because then the ears will become even more hypersensitive.
Yes.
But to have a set of ear protection that a child can carry with them and fully trust that you as the adult are not going to suddenly take it away. Yes. But at the same time, the expectation is most of the time it's off. But when we go into a noisy place, such as a busy supermarket, then you put them on. And maybe let's try something. Let's try going into the supermarket and seeing if you can tolerate it for 1 minute. Yeah. And if you can, that's great. If you're going to put them on after 10 seconds, then put them right on. And we're just testing the boundaries, and that's it.
Yeah, that's exactly it. And when our children grow up, you know, I see a lot of adults where they wish that they had somebody earlier. And do you feel that, like, somebody like a mentor, somebody that understood them? This might be a parent, and that would be great if it was the parent from the start. But if it wasn't, do you feel that our kids would do well, any child really would do well with a mentor that could guide them into social situations and help them through these difficult scenarios from a younger age up to adulthood?
Oh, sure. Up to and through adulthood, actually. Mentors can be vital because they have lived experience, in this case, of being autistic, and will be able to share coping strategies.
Yes.
Promoting success in these areas of challenge. Now, that said, a mentor doesn't necessarily have to be autistic. And I've had mentors, a number of them, that were not on the autism spectrum, and they didn't know that I was on the autism spectrum. But they still were kind people who recognized that maybe I needed some support in particular areas and could be trusted to talk with whenever I needed information.
Yeah, yeah, that's exactly it. My partner is on the spectrum, and sometimes he is also a mentor, and sometimes I know that I need to kind of refer the client or somebody that we work with to him, because he just gets it and he loves systems thinking, and he understands why somebody can go into a rabbit hole of 5 hours of just researching one cultural difference. So I think it is important to know that you need to find somebody that you really connect with. I would have loved to have you as a mentor just with the sensory sensitivities that you were speaking of when I was younger, because I always thought that I didn't like noisy areas because I didn't like a lot of people, and I love people. So for me, it was, I never made the connection of, oh, okay, it is actually the gathering of all those people and the sounds and the smells and the sights. So I think that would have been brilliant for me. And I think for a lot of other youngsters, they would do really well just listening even to your talks, which I will leave a link in the comments section of this video.
Thank you.
Of course. And then lastly, because I know your time is very precious and I really, really appreciate you being here. But with the autism advocates that are increasing is a wonderful thing for me. I feel like we can learn so much from people like yourself, Dr. Temple Grant and Dan Jones. We've got Russell Lehman. We've got people that are really going out there and speaking about their lived experience. I do receive a lot of comments from parents that are saying that they feel a bit scared to ask a specific question because they feel that sometimes they're not using the correct language. I don't know if you've got any experience with this and what you see is happening at the moment, and how do you feel? Sorry, these are a lot of questions. How do you feel?
Go for it.
How do you feel we can work towards working together in a unified manner to actually support autistic kids more and adults?
Yeah, well, I think it's important to realize that parents want the best for their child. They want to reduce suffering and promote success.
Yes.
And parents, autistic advocates are, you might say, experts on advocacy. And we spend a lot of time thinking about terminology and how to express things in the best way possible. Parents are experts at parents, and possibly advocacy too, but not necessarily. So parents, employers, and others, they will use, you might say, wrong terminology or non-PC terminology. Examples include identity first versus person first language. And from what I see now, most autistic adults identify with being autistic. We don't see it as bad.
Yes.
We don't see as autism as something that we carry around with us in a bag, for example, and hopefully we don't forget our bag of autism when we leave the location. And so therefore, I prefer identity first language. If somebody uses person first language, I'll express my preference. I'm not going to have a meltdown. I'm not going to yell at the parent. I think education is where it's at. And parents may or may not fully understand, and none of us do actually, but parents will have questions. Why is my child doing this? Why is my child doing that? What can we do to best help my child? And I think taking the stance of education with people who use wrong terminology, or we consider as wrong terminology, is the better way to go. And certainly we can have debates with parents.
Yes.
But debates, well, I guess they're civil battles, you might say. So the two of us could have a great debate on person versus identity first language. If you preferred one or preferred the other, we wouldn't have to make it a blood sport, and we could still remain friends, even if we have different viewpoints on certain subjects.
Yeah, I think it's we can do anything if we do it with respect.
Right.
I spoke to Russell Lehman, who's an autistic advocate, and he said, call me person with autism, call me autistic person, call me neurodivergent adult, call me Russell, but just do it with respect. And that was a
Mhm.
brilliant line for me
Yeah, it
because
really is. Yeah. Yeah.
yeah,
Yeah, that really is. I mean, it's interesting to think about the implications of
mm,
person versus identity first, and maybe the history behind person first.
mm,
But it's not really something I see I need to get into battles with or even spend all that much time
yeah.
talking about.
Yeah, that is actually true. I think for me, it's just always to give that kind of sense of security for parents that they should
Right.
ask the questions. And
Oh,
um,
yeah.
if we go into other groups of that are like of neurotypical kids, parents ask questions there that I feel like if those questions were asked in autistic groups that it would get a negative response, whereas in neurotypical groups it's kind of parents are just opening up and they're being a little bit more accepting towards that,
Hmm.
which I think is important. But you said it very nicely as well, and I think it is, everything is always about education. So I'm going to leave you there because I know that you need to educate a lot of other people. So thank you so much for your time, Dr.
Oh,
Shore,
you're
and
welcome.